Welcome to the School Mental Health Minute. This is a weekly webcast that focuses on mental health and school issues for children and adolescents. We'll highlight some of the newest research findings and translate the impact and implications of these findings. All this in a couple of minutes. I'm Dan Florell, and let's see what this week's study has to offer. We're featuring a journal article this week titled Depression as a Moderator of Benefit from MediaSmart. The authors wanted to see if a student's level of depression had an impact on the effectiveness of an eating disorder prevention program based in Australia called MediaSmart. MediaSmart is a universal, 8-lesson, school-based media literacy program for young adolescents that targets common risk factors for developing eating disorders. Some risk factors targeted by MediaSmart are media internalization and body dissatisfaction, which includes body shape and weight concerns. Previous research indicated that MediaSmart is an effective intervention for lowering eating disorder risk factors in middle school students that continues to exhibit a positive impact even 2.5 years later. Overall, the authors found that the outcomes of MediaSmart were encouraging for both students with high or low depression levels. Both groups saw declines in their shape and weight concerns, which typically increases during adolescence. More specifically, the high depression group saw immediate short-term declines in eating disorder risk factors. This is impressive considering that depression itself is often a risk factor for developing an eating disorder. Unfortunately, the long-term effectiveness of the program lessened for the high depression group. However, the long-term effectiveness of the program for the low depression group maintained as this group continued to have low levels of shape and weight concerns even 2.5 years later. The takeaway is that MediaSmart is an effective universal intervention program that decreases the risk of developing an eating disorder for middle schoolers. The impact of this program benefits students regardless of their level of depression. School professionals should consider adopting this program into health or physical education curriculums. That concludes this webcast of the School Mental Health Minute. Come back next week, and thanks for watching.